Good afternoon and welcome to BC Today. I'm Amy Bell, filling in for Michelle Elliott. Today we're delving further into BC's publicly funded in-vitro fertilization program that is opening today. BC Health Minister Josie Osborne is speaking to the press about the program now and just started speaking, so let's have a listen in.
The launch of BC's first ever publicly funded IVF program. Our IVF program will help reduce the financial burden this costly process can have on families, support more people in our province on the path to parenthood, and ultimately change lives. Starting today, eligible BC residents will have access to one-time funding of up to $19,000 towards the costs of a single standard IVF cycle. This includes the costs for treatment and medication, and we're working with all of Fertility, the Pacific Centre for Reproductive Medicine, and Grace Fertility for the delivery of this publicly funded IVF program. Funding will be based on household income to ensure that more individuals and families can benefit from the program with greater support for those who need it most. It's estimated the program will fund between 1,100 and 4,500 IVF cycles with the funding that's available this fiscal year. But this program is about more than providing financial support. It's about giving people in our province more options, so no one has to choose between money and their dream of starting a family. The launch of our IVF program is an important step towards a more equitable public healthcare system that ensures people in our province can access the care that they need regardless of their ability to pay. It's about making sure that people have the chance of realizing their dream of becoming a parent. Our government is continuing to take action to strengthen access to healthcare services across British Columbia. And we're continuing to build a healthcare system that puts reproductive autonomy and gender equity at the center. We became the first province back in 2023 to provide free prescription birth control to all BC residents. And since then, 350,000 people have accessed free birth control. This saves women, non-binary, and transgender people money and allows them to make choices that are right for them. We've also expanded the pharmacist's scope of practice so BC residents can walk into a pharmacy and get birth control quicker and easier than ever before. These are the kinds of initiatives that improve the quality of life for people throughout their lifetimes. Our announcement today really reflects our core values, which are grounded in individual autonomy, equitable care, and reproductive rights. We're committed to building a future where people can access the care they need, no matter how much money they make, and have the support that they need to start and grow their families on their own terms. Parenthood is a beautiful and transformative journey, and BC's first ever publicly funded IVF program will ensure that more people can access this life-changing treatment and bring hope to thousands of British Columbians on their path to parenthood. So thank you so much, everyone, for being here today, and I will turn it back to Jennifer. Thank you.
So thank you, Minister Osborne. This is truly a meaningful step forward, one that will bring hope and opportunity to so many people throughout this province. And next, I'd like to invite Dr. Ken Seathram, to share his perspective as a leading family specialist.
Well, thank you very much for the invitation and to the honourable ministers here today and to all of you present. You know, I think as fertility providers, one of the most crucial things that we prescribe is hope. And many who struggle with infertility feel quite hopeless to decide the number and the timing of the children that they want in their family. We all have a fundamental right to obtain the best possible physical and mental health, but fertility can jeopardize that right. Hope gets replaced by despair and fear and anxiety. 1 in 6 people globally suffer from infertility, and access to fertility care is a fundamental and essential human right, as defined both by the World Health Organization and the UN Sustainability Development Goals. Infertility affects populations, it affects society, and it affects human productivity. Canada has a declining birth rate. It actually falls under our population replacement rate. and social and economic factors are the barriers that play a role in this decline. In British Columbia, we also have a problem that we have the highest age of first pregnancy in the nation. People are postponing childbirth, and this further compounds the birth rate issue because this delay collides with the age-related decline in fertility. One of the most successful treatments that we have in the fertility world to cure infertility is IVF. And in this process, what fertility centers do is we give medications to help rescue eggs, and we use those eggs to be fertilized outside the body to create a fertilized egg. That's called an embryo. And when you place that embryo back into the body, the success rates are very, very high. Creating these embryos also allows the opportunity to do other things like test them for genetics or freeze them to allow a patient to expand their family in the future by replacing that embryo. Many people face barriers to this fertility care, including the stigma around infertility, and that's made worse by the financial burden of IVF treatment. This cost burden further erodes hope. Today, however, that changes. We are very fortunate to live a time and a place where progressive policymakers and reproductive science can merge to provide and revitalize hope. BC's new funding program draws from a national experience, stakeholder input, expert input, and this has resulted in a very progressive model which can scale and expand in the future. The program of provincial funding will enable infertility treatments for patients who would not otherwise be able to access IVF care, and that restores hope to people who need it most. Thank you very much again.
Thank you, Dr. Sithra. You are absolutely right. This new funding will open doors for people who could not otherwise access IVF care. It's an incredible and a much needed initiative. And next up, we are very happy to hear directly from Rochelle, who is planning to go through IVF personally.
Good afternoon, everyone. I just want to start by saying thank you. Thank you to everyone who's played a part in getting IVF process funded here in BC. This is going to make a huge difference in so many families' lives, giving people the chance to create families they've been dreaming of. In 2008, I was diagnosed with endometriosis. Hearing that news and knowing having children might be a struggle was really hard. Being a mom has always been something I deeply wanted, and that diagnosis felt like I had a weight I had to carry. Since then, I've gone through 2 major surgeries to remove cysts and manage the endometriosis. But as many as you know, there is no real cure unless you have it surgically removed, and it's something I still live with every single day. In 2021, we are incredibly blessed with our son, our miracle baby. He's the light of our lives, and he's made every challenge along the way so worth it. But we've always hoped to grow our family, and for the past 3 years, we've been trying without any success. That has led us to the IVF journey. Knowing that the government is stepping in, helping with funding, and making a difference, it brings real hope, not just for us, but for so many out there who are going through the same thing. I also want to say a huge thank you to PCRM's team that has been amazing with the start of my IVF journey. So again, thank you from the bottom of my heart. This means more than words can say from my family and countless others. Here's to one step forward for helping families. Thank you.
And we, of course, were listening in to first BC Health Minister Josie Osborne speaking about the new publicly funded IVF program. We also heard from Dr. Ken Seathram, and we had just heard from Rochelle, who will be accessing the fund for her fertility journey. We do know it will be a 1 round of in vitro per patient at a cost of $19,000, and that application is opened up now. So that was BC Health Minister Josie Osborne. But we want to hear from you. What more can be done for the IVF program? Does it provide enough support for those experiencing infertility? And what has your fertility journey been like? Call us at 1-800-825-5950, 604-669-3733, pound 690 on your cell phone. And you can email us, bctoday@cbc.ca. Joining us now is Penny Blesch, founder of the Fertility Coalition of British Columbia. Good afternoon, Penny.
Hi, thank you so much for having me.
No, thank you so much for joining us. This is a big day for so many people across the province. What difference will BC's publicly funded IVF program make to these individuals?
Well, I completely agree with the two people that spoke just before me that this is life-changing. And it is a step forward in the right direction for British Columbia and for Canada. The impact of infertility on a human being is something that isn't really easily described unless you actually experience it yourself. It's devastating. And not only is it physically grueling, going through treatments, and usually more than one treatment, it's financially also very challenging as well. So it feels like there's multiple layers when it comes to infertility. And right now, the government is stepping in and they're helping with one layer of that journey that a patient will be going through. It's going to be a roller coaster ride for anyone who experiences infertility. There will be ups, there will be downs, and you need support throughout this entire journey. I think paying for at least one round, which is approximately $20,000, and determining that based on your income, how much you qualify for, is an excellent, excellent step in the right direction. And I think it's equitable, and I think it'll make a huge difference in so many people's lives. And I hope that this is just the first step in moving forward to building a beautifully sustainable IVF program in British Columbia.
And it was initially set to roll out 3 months ago, but BC Health Minister Josie Osborne, sorry, who we just heard from, said it was delayed because of just how complex it is. How do you feel about the way it is being rolled out now? Is it providing enough support, or do we really need to see it step up more?
Well, I think honestly, it is a massive undertaking for the government to take on. I do think this is something that is, I started the Fertility Coalition of British Columbia. So a coalition is all the stakeholders involved. I think we do need to come together with all of the various pieces, and we can improve and develop a more meaningful and rich program that will support patients throughout their entire journey. I think that the government of BC is doing the very best that they possibly can do in this situation, and that hopefully they're open to learning and growing and changing and adapting as the program is rolled out and they're faced with new challenges along the way.
All right, and we did find out some more details. So we know the fertility clinics that will be participating. Are there still some key questions that you are wanting answers to?
Well, they did answer which clinics are participating, and that is the 3 local clinics. I believe they said that it was Olive, PCRM, and Grace. My question is when other clinics come to British Columbia. So right now, comparably, BC has very few clinics. If you compared it just even per capita for Ontario, I think Ontario has close to 35 clinics. And so there's a lot more access and a lot more capacity. Yes, they have a much larger population, but practically speaking, we only have 3 clinics, and they're of various sizes. So the capacity within British Columbia is actually not as great as other, like Ontario, for example. And while having funding is amazing, when the capacity increases, which it will, because other clinics will be coming to British Columbia to service the needs of British Columbians, will those clinics also receive funding, or will they be left aside and perhaps only private payers can go to those clinics? That is a question as well that I have.
And in terms of there being so few, these clinics, then it does become a question of accessibility, depending on where you are in the province and how long you might have to wait, and those costs that you may have to accrue to access these clinics.
Yeah, absolutely. I mean, there are so many barriers to receiving treatment. Financially is just one of them. As I mentioned, the location, most of these clinics are located like in the lower mainland, so either Burnaby, Vancouver, but people who live in rural parts of the province are outside of, the larger cities have basically no access to treatments. They have to travel. So there's many other costs factored in for these patients in particular. So there's hotel, travel, food, transportation. So these are additional barriers for receiving treatment if you live outside of like the lower mainland, or if you live in northern British Columbia. It makes it really challenging, and I'm hoping that these things are recognized and will become part of the program in terms of coverage, because that is definitely a barrier.
And we have heard that this is unlikely to help everyone conceive. What do you think of BC's decision to provide funding up to $19,000 for one round of IVF? Is that enough?
Well, that's hard. That's a really hard, because like statistically most people need 3 rounds of IVF treatment. And that's a lot. I don't know if it would be reasonable for the BC government to say, oh, we're going to fund up to 3 rounds. I think that is significant. What I think personally, and part of my coalition, is that we do need support from other like societal partners. For example, employers, if they would provide fertility benefits, that would help alleviate some of the drain on like the public system or the public funding. I believe that we're looking also at like a federal IVF program. So if we have multiple sources, the burden of it all does not just fall on the local BC government or our local family, but it's support. This is part of growing society, and I believe that this is a societal thing, that it's not just one institution that's responsible. It's not just the employer. It's not just the government or the healthcare system. We actually all need to come together. This is a much bigger problem than the government can tackle on their own, and just throwing money at it will not fix it. We need to look at other options. We need to look at other support systems. We need to have employer covered benefits that cover at least one cycle of IVF. We need this to be maybe a federal program as well. If we can get 3 rounds covered somehow for an individual, that would be like the ultimate goal. And right now, this is the step in the right direction. But as I said, I think this is multifactorial, and we need support from many, many different areas.
We'd love people to join us. If you have thoughts on the matter, if you feel comfortable sharing your own fertility journey, what supports you've accessed, you can always call us at 1-800-825-5950, 604-669-3733. And you can also email us, bctoday@cbc.ca. We do have a call from Scott in Victoria. Hi, Scott.
Hi, thanks for taking my call.
Of course.
In our current climate, I mean, we've got a lot of stuff coming down the pipe, especially with the U.S. and people losing their jobs and stuff. I just wonder if this is the best usage of taxpayer dollars right now, $20K for people in this situation to have a try at that. I mean, there's a lot of other issues out there, and my concern is, could this money be better spent? I mean, there is a moral aspect, of course, too. I mean, this is not a natural situation to get impregnated and give birth to a child. So, there's several reasons that I would question whether the government should be stepping in this circumstance.
All right. I thank you for sharing your thoughts on that, Scott. And Penny, you know, there is always going to be, of course, an argument for any spending to be placed somewhere else. And I think it is a very, valuable resource for people to access. Would you be able to tell us or be comfortable telling us about your own fertility journey quickly?
Yeah, sure. Absolutely. It started when I first got married, which was a long time ago, and we wanted to have a family as soon as we got married. We, of course, tried and tried and tried for approximately a year. Then our doctor referred us to a fertility specialist, and we did a round of testing to determine, if there were any medical issues. As it turns out, there wasn't. And so we were diagnosed with unknown infertility, which is, it's really challenging to be told that you're infertile, but we don't really know why.
Yeah.
So there's a lot of environmental factors, societal, all sorts of things that can impact someone's fertility, including their age. I was at the time in my early 30s, so I don't think age or egg quality was an issue. So that was undiagnosed. I did receive a number of surgeries. I too did have endometriosis. They discovered that when they did the actual surgery. So I had that treated. I did a number of treatments over the period of 6 years. And finally, with ICSI and IVF, I was able to conceive and have one child. And I have one daughter who is the love of my life. I founded FCBC because of her. I wrote my master's thesis that I just presented to the Minister Josie Osborne on IVF funding in British Columbia. I'm a huge advocate for it. It is, I brought my daughter with me to show that IVF babies are actually human beings, real human beings.
Of course.
Just how they're created is a little bit different, but they're still created by human beings for human beings. And it was just the whole experience. I mean, honestly, they don't talk about the impact on families and how it can destroy families. People who go through infertility often get divorced if they don't become pregnant.
It is a huge stressor and heartbreak for so many families that struggle and that have to go through. And I think it's not talked enough about that impact, that emotional impact, and the ripple effect it can have on people's families. Penny, if you don't mind, I do want to take a call that we've had waiting from Gabby and Prince Rupert. Hi, Gabby.
Hi.
And what are your thoughts on this new program for IVF treatment?
Well, I honestly, when I heard about it, I thought it was great. We had our son in 2022, and since then, he's wonderful and healthy, and we've tried to continue to grow our family. I was just 2 months shy of 40 when we had him. So since then, I've had 2 miscarriages and a late-term termination for medical reasons.
I'm so sorry.
And well, thank you. And so my last miscarriage was just a couple of months ago, and it was with twins, which was especially sad for us. But so when I heard about this, I was really excited because I was like, oh, maybe this could, because again, like you guys had talked about being in the north, we have the added costs of travel.
Right.
In addition to just the medical costs of IVF. But I was disappointed to hear that the age cutoff was 41, especially knowing that more people are getting pregnant at a later age. Yeah. So because I'm 43, this program won't, we can't apply for it, which was disappointing. So I'm hoping that the province will open it up to older parents.
Gabby, thank you so much for sharing that with us. And again, so sorry for your loss, and deeply appreciate you sharing that with us. But Penny, that does bring up one issue that many people have objected to, and that is the age cutoff, 41, when it is true, as she was saying, so many people are waiting until later in their life to have children. Are you at all hopeful or hoping they will perhaps broaden that age range up?
Yes, definitely. I was actually finally, I got pregnant when I was 39 years old. So I know how close that is to 40. And statistically, IVF isn't as effective after the age 43. And so I guess from the government's perspective is that they want to give it to the people that would be most able to actually conceive, like statistically speaking. Do I think that it's right? No, but I understand it. I think, of course, it should be open to people who are over 40 because they're the ones who truly need the help.
Yeah.
But it all comes down to statistics and viability. And honestly, the older you get, 43 on, IVF becomes less and less successful.
Penny, we will have to leave it there for today. I really appreciate you taking time with us, and we will touch base with you again soon.
Thank you so much for having me.
And that was Penny Blesch with the founder of the Fertility Coalition of British Columbia. It is now time for the CBC News with Robert Zimmerman.
Good afternoon. The BC Wildfire Service says one of the wildfires near Lytton is now considered held. It was discovered Monday on the 4th anniversary of the fire that destroyed most of the village and left 2 people dead. The fire prompted a state of local emergency, but the Wildfire Service now says on its website it believes the blaze will remain within its current perimeter. A second fire is also burning north of Lytton. The City of Victoria is spending $10 million to improve public safety in the downtown area. Mayor Marianne Alto says people are tired of street disorder, petty crime, and the damage to public spaces. The money for the safety plan will be taken from other city programs. And the provincial government says it's speeding up construction timelines and reducing upfront costs for home builders. Housing Minister Ravi Kahlon says home builders will no longer be required to pay most development cost charges at the start, but rather at occupancy. The changes come into effect January 1st. And now the forecast on the north coast. A chance of showers and thunderstorms this afternoon with a high of 13. Highs reaching 22 and mainly cloudy in the Peace. In the central interior, including Prince George, showers or thunderstorms with a high of 18 degrees. Highs in the mid-30s with a chance of showers and thunderstorms in the Kootenays. In the southern interior, including Kelowna, sunny with a high of 31. And for Metro Vancouver, Greater Victoria, and the Fraser Valley, a mix of sun and cloud this afternoon with highs around 23. That's your CBC News update from Vancouver.
Thank you very much for that, Robert. And every Wednesday at noon here at the CBC British Columbia building, we are going to hold free concerts. That is right, free, right at the CBC Outdoor Plaza at 700 Hamilton Street, and it'll happen around this time. Our own Stephen Quinn and Lisa Christensen are out there right now hosting the shindig, and today we are kicking things off in style with Vancouver's own rock extravaganza, Brass Camel. Let's listen in. We are keeping an eye on the wildfires burning near Lytton, BC. There are 2 fires burning nearby. The Niigaan Creek wildfire is about 6 hectares in size and burning out of control, which prompted Thompson-Nicola Regional District to declare a state of local emergency and issue evacuation orders for 2 properties. This comes as the scars remain of the devastating wildfire that destroyed the village 4 years ago. Tricia Thorpe is the area director for Blue Sky Country in the Thompson-Nicola Regional District. She also lost her nearby home to the fire 4 years ago, and she spoke to Stephen Quinn on the early edition this morning.
How has the process of building back been for you?
It's been different because we were not part of the municipality.
Yes.
So a lot of the help that came from the province and the federal government did not apply to those that lived in the regional district. We have, however, been really, really lucky. We had an incredible group of community and friends that have helped us move forward. Without them, we wouldn't be where we're at right now. Well, we have a couple of properties on evacuation order over on the west side with the Niigaan Creek fire. I think that one, from what I understand, talking to residents, it's still a concern, but it hasn't really grown a whole lot. When it broke out on the 30th, it was pretty spectacular. And that's a horrible word to use,
Yeah.
but it was its presence was known, let's put it that way. And we're very lucky that we have a group of local volunteers that kind of tromped it down until such time as BC Wildfire got there.
The BC Wildfire Service says crews supported by firefighters from Lytton First Nation made good progress overnight. There are 78 active wildfires burning in the province. Last month, the Movember Institute of Men's Health released a national report on the state of men's health in Canada, and the findings are stark. More than 44% of men living in Canada will die prematurely from largely preventable causes, with men disproportionately impacted by suicide and the opioid crisis. So how can we better support men's health? What are the barriers preventing men from accessing care? Call us at 1-800-825-5950, 604-669-3733, pound 690 on your cell phone, and you can email bctoday@cbc.ca. Joining us now is Anishinaabe writer, editor, professor, activist, and co-author of The Real Face of Men's Health report, Niigaan Sinclair. Hello, Niigaan. How are you?
Bonjour. Thanks for having me.
Oh, thank you so much for joining us. What are some of the key findings from this report? Quite shocking, the numbers that you have uncovered.
So myself and researchers at the University of British Columbia worked on this report, as well as a whole host of international researchers as well. And what we're finding is that in Canada, there is a disproportionate men who are experiencing premature death due to a whole series of outcomes. And those outcomes relate a lot with mental health. They relate a lot with diet. They also relate a lot with stereotypes that lead to many men in many particular marginalized areas to experience harm in some way or another. Sometimes that harm is to themselves, but sometimes that harm is from institutions like injustice or in health or in child welfare.
And what are some of the biggest barriers that men are facing when it comes to accessing proper health care for themselves? Is it majority economic? Is it social? Where are we seeing these breakdowns?
Well, the question actually begins before that. It's in the notion of mentorship, in the notion of raising young men in positive, healthy ways. Because what's often happening is that because of long cycles of perhaps ignorance or perhaps outright denial of the experiences of men within societies. And this is all men, but in particular, marginalized men, Indigenous men, newcomer men. They are put into situations in which they're often overburdened, or they're put into situations in which they aren't at home, sometimes in situations involving the justice system, but it also could just be carrying multiple jobs. And what ends up happening is that young men are not mentored by other men in healthy ways. And that puts a disproportional amount of emphasis on women, particularly to raise children, but also to work hard to make a healthy home. And then those men are in situations in which they feel disenfranchised, and for one reason or another, often turn to stereotypes that they may have been taught. They turn to areas of unhealthy behaviors, or then sometimes what ends up happening is that many men feel confused and lost, and all of this leads to challenges in mental health, injustice. And then what we have to really do is we have to reestablish those systems in which we support young men, and for those men who are already ages like myself, being able to help them to become healthy individuals and contributing members within their own communities.
Well, and how do we get that conversation going? Because you talk about these stereotypes, and we have all heard them. Men don't cry. They're supposed to be tough and push through the pain. How do we have these conversations so that men will feel that can be vulnerable, will not feel shame in seeking help, whether it's for mental or physical issues?
Well, we have two forces that are at play here. One is there are many ways, systems, institutions that encourage men to be healthy fathers, uncles, grandfathers, sons. And then at the same time, we also have institutions that are encouraging unhealthy behaviors, or what I'll refer to as the hypermasculine. That's the thing you're speaking about when you talk men don't cry, men treat particularly, women, two-spirit peoples, those who are weaker than them, physically weaker, in particular ways. And those kinds of learned behaviors are very powerful. They exist everywhere within the internet, within, when I was growing up, pop media. And then, of course, there's the whole nature that it becomes entrenched within attitudes that the hypermasculine, the toxic behaviors become normalized within society. And so what we really have to do is we have to institute those traditional, family-based, community-supporting roles that men have traditionally held within many different cultures throughout the world, but in my case, particularly Indigenous cultures, and try to hold those up as the bars, the frames, the standards in which we want men to act. And this won't be done punitively. It won't be done by wagging fingers. It will be done through offering positive outcomes, positive supports, and particularly a whole lot of patience and understanding for many men who are going through those patterns of trying to relearn, but then in the case of young men, learn those for the first time.
Well, and I know that the suicide and the opioid crisis are cited as two major factors for premature death in men, and both mental health and addiction have such shame and stigma wrapped around them. It is very difficult for anybody to access help or to ask for help, but especially for men. And I would think for those marginalized communities, how do we address that while we still can before we lose more men to these two factors?
So the biggest enemy is shame and a loss of identity or a positive relationship with yourself, with other men around you, with the land, with your history, ancestry, culture. These are all institutions that we have to build significantly. But at the same time, we also have to help those who are surrounded by men who sometimes are experiencing great deals of harm to be able to be in safe situations while men are going through those processes of relearning who they are. The shame is a big enemy because what it means is we think oftentimes that shame will lead to better behaviors, but it doesn't. Shame leads to more trauma. Trauma leads to silence and violence. At the very worst case scenario, men are taking out violence involving their shame on others. But equally as bad is not talking about it, is intrinsically including repressing those feelings and then producing things like suicide epidemics or addictions, which of course recreates the problem over generations over generations.
And I would love to have our audience members join us if you have any thoughts on the state of men's health, if you have any questions about this new reporting on how much more we need to do to make sure that these various issues are being supported. You can email us, bctoday@cbc.ca. You can also call us at 1-800-825-5950, 604-669-3733. Niigaan, you do, in the report, it also found that Indigenous men are facing unique challenges when it comes to their health and well-being. How deeply are they being impacted?
Well, historically, Indigenous men have been avalanched with views of manhood that often comes outside of their communities, in many cases Europe. And that standard was then imposed both on men and then directly impacted women. For instance, many grandmothers and mothers, aunties, daughters were leaders in our communities. But of course, in many institutions, when dealing with Western forces that came to our communities, they were not recognized as those leaders. And men were put into positions, either forcibly put into those positions or took those positions on. And then disenfranchised women also put themselves into situations in which they could not handle. And then this has led to the mess that we now know of today, where we can still see in many circles, particularly in First Nations throughout the country, many men are the chiefs and women are left outside of those areas of decision making. That all creates a toxic situation in which men are given a great deal of power. Women are often struggling for that power or inheriting the legacies that come from that power, which often involves being outside of the room, disenfranchised, violence. And this is an imbalance that we have to deal with. If we look at our traditional societies and the bringing back in for language, for example, there often wasn't gender in most of our languages, or if there was gender, there was an innate sense of balance within ceremonies, within our cultures, within the ways that we treated each other, particularly when you look at, for instance, fasting, or if you're out in BC, the potluck, there was an inherent balance in genders in the ways in which people shared wealth, for example.
Well, and in terms of men's health having this ripple effect, it has an impact on women. It has an impact on families. It has an impact on the economy. What are some of the ways that we might not think men's health is affecting us or reaching other people?
Well, I mean, there's some very simple outcomes. If there is no father, uncle, grandfather in a home, there are double the work for women in that home. There also is a lack of achievement within certain areas of raising children, meaning that if a young man or a young woman is raised up and has questions about gender identity, about certain particular ceremonies that involve ideas of gender, if that uncle father or grandfather or even son or nephew is not present for one reason or another, then they'll always have the questions. Those questions will remain unanswered. There are 100 other different ways that is impacted, but the most simplest way to think about it is that if Indigenous men continue to harm themselves and others, if that's what we are taught is a healthy male behavior, then what we are left with is a whole lot of harm, because that harm is then spread, lasts for legacies and generations, and that we have to talk about that harm, we have to acknowledge the harm, and then we also have to do something about the harm. And particularly, we will not do that by shaming, by producing more harm on top of other harm. And that's one of the big problems in social media, for example, or in many circles involving call-out culture or shaming culture. That those are not solutions. They're not certainly Indigenous solutions, and they will not be able to produce a kind of sense of healthy community. What we need is a restorative process in which we can come together to acknowledge, help, and also be patient while creating safe circumstances for those who are experiencing harm.
I do have a call that's just come in from Pete in Vancouver. Hi, Pete. Thanks for joining BC Today.
Hi.
Hi.
Yeah, interesting conversation. one thing I would add is I would like to see BC politicians and health authorities have specific programs for people with conditions that have higher rates of men. So, for example, substance use disorder, homelessness, suicide. Like, both men and women have those problems, and they both should be dealt with. But there are much higher rates in men, and if they were like higher rates of women with that condition, there'd probably be a female-only strategy for it. Not only female, right? But they would have a targeted one. But we are not seen as valuable enough in society to do that. Economically, yes, but in terms of, health in our life, not so much. So, for example, in Australia, they had a specific program around suicide for men. So what I would like to see is some evidence-based strategies where they work with men and people who've got a lot of experience with men with that condition and have specific targeted programs for men.
Thank you.
It doesn't exclude others, but at least have something for them, because right now they don't, and it's nuts that they don't. It's just doesn't make any sense economically or humanly.
Well, thank you for that, Pete. And I was going to ask you, Niigaan, about this. What do we need to be doing in terms of the federal government, provincial governments, and healthcare providers? How do we sort of focus in on men's health and make sure these conversations are happening and this education is being given to them, meeting them where they are in a sense?
Yeah, thanks to Pete for the call. Where do we begin? But I would just encourage people to look at the report, because the recommendations in the report are vast. Everything from health to all systems of society's education, particularly. But then what I would say is probably the most important thing is that we have to bring ourselves to the reality that this is a national epidemic. The premature deaths of men is not only the unacceptable thing. We shouldn't just be surprised by that, because it's right in front of us. This epidemic is absolutely in front of us. It's something that takes place in movies and magazines and on the internet. It's part of our everyday lives, the way we treat each other. And we are creating a situation that is just simply untenable. And it's creating vast problems politically. If we just look at the ways in which our own politics, take any picture of any government, and you'll see that women are oftentimes not on the same proportion as men, CEOs, et cetera. I could just keep going. The biggest thing I think we have to deal with is we have to deal with a positive sense of manhood that has to live within all conversations in society. And it has to really start with men raising their sons, their nephews. And then on top of that, we have to train people, particularly within certain frontline services, health, within schools, universities, but then also particularly within areas of social services, because mental health is one of the biggest challenges that are going to be coming forth. And what I've always said is that pancake breakfasts will solve more than police ever will. So we have to stop thinking punitively of punishing men when they're learning about their manhood.
Such incredibly important points. We have a new call in from Cody in Trail. Hi, Cody. Thanks for calling in.
Hello, Amy. How are you?
I'm doing great.
I hate to be a Debbie Downer, but I'm going to disagree with everything that Mr. Sinclair has just said. I probably would never want to read his book. But I disagree with everything that Pete says, because ultimately, when it comes down to it, the barriers that we face when we're accessing healthcare, and we wouldn't have healthcare if it wasn't for Tommy Douglas, and your guest should know that because he lives in Saskatchewan, where Tommy Douglas originated. Because when we're accessing healthcare, we have barriers because of sexual orientation, whether or not we can afford it, and the disability and disability aspects of it. Because I'm a 38-year-old gentleman, and I try to access healthcare in Trail. You think I can get a doctor? No. No, I can't. And no doctors take me seriously if I ever try to tell them that I have scoliosis. So I would strongly urge your guest to do his homework, look up Tommy Douglas, because he gave us universal health care, and we would not have it in Canada if it wasn't for him.
Okay, thank you for calling in, Cody. Would like to point out that that Niigaan has done a tremendous amount of research on this topic. And I do appreciate you taking time to share with us today. In terms of, moving forward, what is the best sort of first step somebody can take? And I appreciate we only have a minute left in our show, but what's the first thing a man can do to really address his health here?
I think the most important thing is realize that communities are whole places. They need everybody. And most importantly is that we have, one thing I accept and recognize within the caller is that we really have to focus a lot on two-spirit peoples, particularly those who have been disenfranchised, because we are only starting to look at the situations and supporting of women, and we have to do way far more than that. But particularly, we have completely, almost absently, or perhaps intrinsically, or overtly in some way or another, thought that men can just get over this and men can just somehow endure the traumas that they've been experiencing within society around them, and that somehow they'll turn healthy just naturally. Right. For a long time, this has been a long process in which men have been taught very unhealthy behaviors that have harmed themselves and also harmed those around them. And we really have to step up to the reality that we have to be brave and have a brave conversation, but we will not do that punitively. We must do it positively.
Niigaan, thank you so much for joining us today. Much appreciated.
Yeah, Miigwech, thanks so much.
That was Niigaan Sinclair, author of The Real Face of Men's Health Report.